Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. So I'm always grateful when I get ideas for the podcast from listeners. And on this episode of the podcast, I'm going to provide some potential roles that you can apply to today if you're a new health informatics graduate or you're looking to pivot into the field. And again, I love getting your feedback on different topics I should talk about on the podcast. And if you look in the show notes, I have a survey where you can give your opinion on topics I should cover in future episodes. So without further ado, let's get into the episode. So the first role that you can apply to if you're a new graduate to the health informatics field would be the role of a clinical systems analyst. And in this role, you might be the in-between person to communicate the needs of the vendor that the hospital might hire to produce computer information systems and the clinical staff. So you'll often be that in-between person to communicate the needs from the clinical staff to the vendors on how they can improve the system. Usually in this role, this can often result in documenting user requirements and how they interact with the system. And also you might be responsible for documenting any ongoing changes to the system and researching improvements or integrations that could be added to the system for improved usability. So you're really that translator between the technical side and the clinical side. And it can be a good segue from someone who might be a clinical user who could move into a super user role, becoming very well versed with either like the EHR or another computer system that's used in the hospital. And then eventually they could even move to this clinical systems role. So in the clinical systems role, it generally has a good work-life balance. Of course, this is very highly dependent on the organization, but you might only be expected to work overtime when there are downtime issues or crises that might happen within the organization. But overall, this role tends to have a good work-life balance. So the next role I want to talk about that students or people looking to pivot into this role might want to apply to is the role of the EHR analyst. So again, it has very similar job duties to the clinical systems analyst, but again, it can be more specialized to a specific EHR system that might be implemented into a healthcare organization. So for instance, if a healthcare organization is implementing Cerner, the healthcare organization might be looking for someone who is well versed with Cerner and who can help guide clinicians to use the software in the hospital. And on the other hand, Cerner or Epic, these vendor organizations themselves, might hire someone who can implement the software into different healthcare organizations. So this role might require you to train and educate clinical staff on the use of the EHR and act as an in-between between the vendor and the clinical team to communicate gaps or risks during the implementation process. And this job might require lots of traveling between hospital systems and the vendor organization and might require longer hours in terms of work-life balance. So a quick story, when I first graduated from my master's in biomedical engineering, my naive impression was that after all this schooling, it should be relatively easy to find a job in my field. However, this was not the case at all. What really helped me to get my first job was primarily the network I grew during school and after school, attending events related to digital health and health informatics. And this is really what I want to pass on to new graduate students is don't just rely on the classes that you're taking or your grades. Really work to build your network during school, whether that looks like applying for internships or co-op placements, or just attending events that are put on by your school. So for instance, I attended an event called Hacking Health, which was a hackathon where people from multiple different backgrounds got together. So we had people in the computer science discipline, medicine, public health, etc. And we all got together in one room to try and solve a healthcare problem using our each unique set of skills. So the team that I worked on included developers, clinicians, and engineers. And our focus was to build a mental health app targeted for doctors. I learned a lot being on that team, but one of the best parts was I was able to grow my network and meet people from diverse backgrounds. In school, you really generally meet people of the same background. Even if you're doing your master's, people tend to have similar degrees. And so that was really an opportunity for me to expand my horizons and really learn from people who have different backgrounds than me. And this really helped to further my job search much more than just sending my resume into the dark void of Indeed or LinkedIn and hoping to hear back. So if you want some more tips on how you can break into the health informatics field as a new grad or someone looking to pivot into the field, again, in the show notes of this episode, I will link to my free guide to starting your career in health informatics. So I want to go over 2 more roles that you can apply to as a recent health informatics graduate. And the third one is the clinical decision support analyst. So the focus of this role might be on building reports or dashboards to help guide evidence-based decisions within the healthcare organization. And this can look like individuals analyzing the data and writing queries using SQL, which stands for Structured Query Language. And this is a programming language used to manipulate and extract key information from databases. So for example, if you have one table in your database that contains general patient health information like the patient ID, what disease they might have, and then you can have another table in your database which contains patient geographic information, so where they generally live. And so if you want to join these 2 tables together into one large table for analysis, you would use SQL to carry out joins, and you join these 2 tables together. In addition, in the role of a clinical decision support analyst, you might carry out descriptive statistics using programs such as R, Python, or SAS. And once you've loaded in your data set, analyzed it using SQL, then done some statistical analysis on it using R, Python, or SAS, finally, you might want to visualize your analysis in order to make it understandable for a wide audience who might not have a technical background. And so to do this, you might use tools such as Excel, Crystal Reports, SSRS Reports, Power BI, Click, or Tableau. There's several different visualization tools that you could use to communicate your key insights. So this role will most likely involve presenting your results to stakeholders and will require strong communication skills to be able to explain technical concepts to a potentially non-technical audience. So this role is a good balance between working both your soft skills in terms of communicating and presentations and your technical skills in terms of using your analytical mindset. And for this role, the clinical systems analyst tends to have a pretty balanced work-life balance. Again, you might be working overtime if there's a real crisis in your healthcare organization, but generally it could be a typical 9 to 5. And the last role that I would suggest new grads to look up if they're interested in a health informatics role is the role of the methodologist. So this is a role really focused on developing and analyzing research products and projects. The analysis done in these research projects can help to inform clinical practice and can create relevant benchmarks that healthcare organizations can use as a reference for where they should target their key performance indicators. So for example, as a result of several research projects and studies completed, a healthcare organization can analyze these, can understand what the average hospital readmission rate is in their area, and should be based on their hospital size and location. And they can work to be way below this average. So the role of the methodologist can include carrying out literature reviews of the current body of work, identifying data sources or survey methods needed to obtain relevant data sources. And in addition, this role can be quite heavy on statistical analysis to ensure the correct methods are chosen when analyzing and summarizing statistically relevant and significant results. So this role is quite technical and will most likely require a strong foundation and interest in statistics and biostatistics. So keep that in mind when you are looking for these roles. Methodologist, another similar one is epidemiologist. Again, the work-life balance is pretty standard to the other roles that I described, 9 to 5, but you might have some unique situations where you're working overtime. So I hope this podcast episode has given you some concrete examples that you can apply to today if you're a new health informatics graduate or looking to pivot into the field. And I'd love to hear from you. As always, you can drop me a line at HealthAnalyticInsights@gmail.com. Which one out of these roles best suits your personality and interests? Thanks, and I hope you have a wonderful day. Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.